My thing in my second pregnancy was watermelon. I could not eat enough watermelon. My husband would be like, "Did you eat an entire watermelon today?" I'd be like, "Yes." I mean, I don't know. It just tastes so good. So I am a big fan of listening to your body, and you know, the idea that cravings might be telling your body you need something in particular, I don't know that there's a lot of good science to support that, but certainly if it tastes good and sounds good to you, I think you should feel like that's something you can enjoy. The one caveat to that is making sure that that's generally a healthy food. If it's not a healthy food, you know, it's something we want you to enjoy in moderation. So if a woman is craving ice cream every day, if you eat ice cream every day throughout your pregnancy, we're gonna have some other problems related to diabetes or excessive weight gain, those type of things. And so wanting to kind of scale that back a little bit to something that is more moderate, maybe ice cream a couple times a week rather than every day. But as long as weight gain has been appropriate and you know you're on track in terms of getting those other healthy nutrients spaced out throughout your diet, listening to the cravings is totally fine. I always tell people your body is going to make a baby that you're capable of delivering, and statistically that's actually pretty true. There's rare situations where a baby's too big. There is a genetic component to the baby's size and the growth, but it's not a universal thing. The main way that we establish who is in active labor is by contractions. So when you start having painful contractions, we want you to time those. And when you are having contractions that are about every 5 minutes, each one lasting about a minute, and for that going on for about an hour, that's what we refer to as the 5-1-1 rule. So contractions every 5 minutes, lasting a minute, going on for 1 hour. That's when you are likely transitioning into the more active phase of labor. And that's absolutely when we want you to be calling or coming into the hospital for evaluation. The other things that can tell us that you are moving into labor would be feeling like you broke your bag of water, so a big gush of fluid. Any vaginal bleeding or spotting can indicate that your cervix is starting to change. And so that's another thing to be watching for. So definitely all of those things are things we would want you to seek medical care for.